Hello everyone, welcome to today's lesson with calebmulonga on Nursing Insight with calebmulonga. So today we're going to look at the nursing care plan for congestive cardiac failure. In the previous videos, we have looked at the nursing care plan for hypertension and acute renal failure. And you can see there is a connection between these conditions. And today we continue with these conditions, but we are now looking at congestive cardiac failure. So here our patient that we are nursing here has a condition we're calling congestive cardiac failure, popularly known as heart failure. So our first problem is decreased cardiac output. So decreased cardiac output is basically when the heart is producing less, is ejecting less blood from the left ventricle. It's ejecting less blood from the heart when the heart is ejecting less blood. So what this simply means is that the heart has a duty to eject enough blood that will go to the lungs and later on go to all parts of the body where it will provide the body with oxygen and all these other nutrients. So you find that in congestive cardiac failure, there is a decreased ejection of this blood. So the nursing diagnosis is decreased cardiac output related to impaired contractility or myocardial contractility evidenced by third heart sound on auscultation. So what we mean here is that the decreased cardiac output is coming as a result of impaired myocardial contractility. So there will be an impaired contractility of the heart. The heart will not be contracting as it can or it is used to because the myocardium is failing. And this will be seen or heard when auscultating when there is a third sound which is normally called the murmur. So this sound will be heard during auscultation. The objective or goal for our problem to improve the cardiac output as evidenced by blood pressure and heart rate within patient's normal limits throughout hospitalization. So our goal here is to make sure that the patient has the BP and heart rate within his or her normal ranges or limits throughout hospitalization. Then we go to our nursing intervention. How are we going to improve or how are we going to maintain a good cardiac output? First and foremost, we are going to monitor and record the blood pressure for vascular and cardiac performance. So here monitoring the blood pressure will show us how the heart is performing. Remember, here our myocardium is failing. The myocardium of this patient is failing. So by monitoring the blood pressure, we can tell if the congestive cardiac failure is worsening or not. So that's our first point. Our second point is I will observe skin color, moisture, temperature, and capillary fill time to monitor peripheral vasoconstriction and decreased cardiac output. So here our concentration is on the decreased cardiac output, and you find that here the heart to the left ventricle is ejecting less blood into the body, which means that there will be less oxygenated blood going to all parts of the body. That means when you are monitoring the skin, the moisture, the temperature, and the capillary fill time, you'll be able to note that the capillary fill time will be slow, will not be normal. then we'll find that the temperature of the skin and the color will change because of reduced blood being supplied to all these parts of the body. The third point is I will maintain activity restrictions such as bed rest to promote rest and reduce the workload of the heart. So here you find that because because the heart of our patient here is failing, he does not need more work. So by restricting our patient to bed rest, this will enable the heart to be relieved of the stress of the workload. So by telling this patient to be on bed rest, we are promoting rest and reducing the workload that will be on the heart if this patient is doing activity. So that's our third point. And our last point is I will administer the prescribed antihypertensive drugs to promote vasodilatation and cardiac performance. So here you find that we will administer the prescribed drugs just to promote vasodilatation and cardiac performance. And the other point that we can put is I will administer digoxin to promote cardiac performance or cardiac contractility. So you find that digoxin here is a drug that will help the heart to contract better, to improve the contractility of the heart. So that is another drug that we can give while nursing our patient with decreased cardiac output. Evaluation. The patient cardiac output is maintained within normal ranges, evidenced by normal and regular heart rate and BP blood pressure of 120/85 millimeters of mercury. So you find that here now when you're evaluating our patient, we will say the blood pressure or the heart rate has been maintained within the normals of this patient, and in this case the normals of our patient is 120/85 millimeters of mercury. So that's our first problem. Our second problem is activity intolerance. So in a patient with congestive cardiac failure, it is noted that they reduced oxygen supply to body tissues, and this will result into fatigue or weakness. So the patient will not be able to tolerate certain activities of daily living because there is reduced oxygen supply, which will result into fatigue and weakness. So that's our problem. And then for nursing diagnosis, activity intolerance related to imbalance between oxygen supply and demand, evidenced by verbal reports of fatigue or weakness. So here you find that because there is an imbalance between the oxygen supply and the demand of oxygen by the body, you find that there will be less oxygen going to the tissues, therefore there will be situations or cases of tissue hypoxia and all that. So that will now manifest in fatigue and weakness, causing activity intolerance in our patient. Then the third, now we go to the objective or goal of this problem. So what do we want to do at the end? So we want our patient to report their ability to perform regular activities or required activity of daily living by the time of discharge. So we want our patient to be able to do these activities of daily living, such as bathing, walking, eating, all these activities that are needed by the person. Then now, how are we going to achieve this? That's where now we're going to talk about the nursing interventions for activity intolerance. The first nursing intervention is I will assess the patient's response to activity to determine the level of activity tolerance. So here we are going to assess how the patient is responding to activity. So in a case where this patient is mostly in bed, we're going to tell this patient to try out an activity, for example, walking. We're going to tell this patient just to walk for a short distance, and we are going to assess how is this person responding to this exercise, and we can now determine to say this person is getting extremely tired from just walking here and to there, so they cannot tolerate this activity. So we know the patient cannot tolerate this activity. And the second point, I will gradually increase activity with activity range of motion exercise in bed, increase to sitting, and then standing to prevent over excision. So you find that here we want to make the patient tolerant, the patient to tolerate activity. So we have to increase the levels of activity tolerance slowly or gradually. We have to ease the patient into the activity. So the first thing that we do is we tell the patient, or we instruct the patient, or even us as nurses will try to perform activity range of motion exercises in bed, meaning I will try to move the patient's legs, move the patient's hands, or instruct the patient to move these extremities. Range of motion, maybe move to one side and see how the person is coping. From there, we'll tell the patient to be sitting. After some days, we tell the patient to sit, to see, ease them slowly. And then from sitting, we tell them to be now standing. We are easing them slowly but sure into um, performing these activities. And the third point, I will encourage the patients to refrain from performing non-essential activities to save energy. So here you find that this patient has a failing myocardium. So they need to reduce on the amount of activities that they are doing so that can help the failing heart or myocardium not to have too much workload or stress. So we are going to instruct the patient to refrain from non-essential activities so that they can save energy, therefore reduce the stress on the heart. Our final point, I will encourage the patients to perform activities at a slow pace in a longer time with more rest or pauses to increase tolerance to activity. So here what we're basically saying is we encourage the patients to take this activity that they're used to doing this certain activity at a faster pace. For instance, a patient can be walking fast. Before or prior to the condition, they might be used to be walking at a certain type of pace. So we will tell the patient to be slower, to do the activity at a slower pace so that they can ease back into doing these activities. Or even take time, even rest, do pauses so that they can be tolerant, they can build that tolerance, they can ease into the activity. So these are some of the interventions that we have put in place to treat or to nurse this patient with activity intolerance. We move to our evaluation. Patient reports improved ability to perform required activities of daily living, evidenced by patient performing self-care activities. So you find that when we're evaluating our patient after putting all these interventions in place, patient will now say, I have the ability to perform certain type of activities or the required daily activities of daily living evidenced by this patient performing these activities, such as patient walking, patient eating. These are some of the activities of daily living. We move to our third problem, which is excessive fluid volume. So here, excessive fluid volume is a situation where the patient has a lot of fluid buildup in the body. So this fluid volume is as a result of fluid retention and decreased cardiac output. So to learn more about fluid volume, excessive fluid volume, you can refer to the other videos that we spoke about in the pathophysiology of CCF. You find a well-detailed explanation of how excessive fluid volume is coming about. Just check out the video and you'll be able to learn more. But basically, excessive fluid volume is coming as a result of decreased cardiac output and increased fluid retention. So our nursing diagnosis: excessive fluid volume related to decreased cardiac output, evidenced by generalized tissue edema and weight gain. So you find that because of this fluid volume in the body, excessive fluid volume in the patient's body, you find that it will manifest by edema and weight gain. The patient will have edema and they will gain weight. So what is our goal for this problem? Our goal is to reduce fluid overload throughout hospitalization. We want to reduce the fluid overload that is found in this patient. How are we going to reduce this fluid overload? So the nursing intervention is, the first thing that I will do is I will accurately record intake and output on the fluid balance chart, monitor fluid retention. So I want to know, is this patient's fluid being retained? So I will make sure that I record on the fluid balance chart the amount of fluid that this patient is taking in. It can be oral or through intravenously. So we have to make sure that we know how much fluid the patient is taking in and how much the fluid is coming out, meaning through urination and all these other things. And then from there, after we record the intake and the output of fluid on the fluid balance chart, we'll go to the next one, which is I will weigh the patient daily to determine whether excess fluid volume is improving. So here our patient, we know that there will be weight gain. Weight gain is coming about due to the retention of the fluid. So I will weigh this patient daily so that I will know if the amount, if there is excess, if there is more fluid buildup in the body, or if the excess fluid volume is reducing or improving. And then our third point is I will restrict fluid intake as prescribed to avoid more fluid buildup in the body. So here again, we have to make sure that we restrict fluid intake as prescribed. So here we'll tell the patient not to be taking a lot of fluids because they have a lot of fluids in their body. We'll also instruct them to be just taking in a little amount of fluid. So as prescribed, the physician will prescribe the amount of fluids that this patient can take in. So that's what we mean when we say restrict fluid intake. And the last point, I will administer prescribed diuretics to increase excretion of excessive fluids. So here we're saying I will administer the prescribed diuretics such as Lasix to increase the excretion of excess fluids. So Lasix will help remove these extra fluids through urination, and now that will result into a reduction of this excess fluid volume in the body. So having put all these interventions in action, how are we going to know that we have achieved our goal? We are going to evaluate our patient. The evaluation is excessive fluid volume has reduced, evidenced by reduced body weight and gain and tissue edema. So you find that the patient will show that the excessive fluid volume has reduced, and it will show by a reduction in the weight and a reduction in tissue edema. So this is one where we can tell that the patient's fluid volume has reduced. We move to our fourth actual problem. So our fourth actual problem is ineffective coping. So ineffective coping is a situation where a person cannot cope with the new situation. So this person with congestive cardiac failure is failing to accept, is failing to, does not have the ability to cope with the new condition, which is CCF. So as you know, such conditions are very dangerous and has a reputation in the society to say whoever is found with this condition is more likely to die than to survive. So people have all that going through their head. They have the anxiety and they have all these other things, the lack of knowledge, and all that will build up, and now the person will fail to cope. They will not have the confidence to say, I can survive through, I can go through and survive even though this condition is dangerous. So the nursing diagnosis of this problem is ineffective coping related to inadequate level of confidence in ability to cope, evidenced by verbalization of inability to cope. So here you find that the patient will lose the confidence for them to cope or for them to survive regardless of the condition. So you find that the patient will not have that confidence to survive because they know that this condition is deadly. The condition is fatal. So they will not cope, or they'll fail to cope. So what is the goal? How are we going to, what do we want to achieve at the end? So the patient verbalize he or she feels more confident about dealing with the situation by the time of discharge. So we want patients to feel more confident about dealing with the situation or dealing with the condition. So here the patient will say that she or he feels more confident that she's going to go through and be okay. So now how are we going to achieve that? So we're going to put the nursing interventions in place. The first intervention is I will create a working relationship with the patient through continuity of care to establish trust and facilitate coping. So here we are going to make or create a work relationship, a rapport between the patient and the nurse, so that we can establish trust, we can continue the care and facilitate coping. You as a nurse, me as a nurse, being creating a relationship with the patient will help the patient to cope. So that's one of the interventions. Second intervention is I will assist the patient to set realistic goals and identify personal skills and knowledge to cope to the situation. So here you find that because because this patient has been going through or is going through a condition or a situation they're not used to, they will lose that ability to set realistic goals. So you as a nurse, it's your duty to assist the patient to set realistic goals and identify the personal skills, because this person has the ability, they have the skills that the Lord provided them to cope with any situation. So you as a nurse, you have the ability, you need to assist the patient to set realistic goals and identify personal skills and knowledge to cope with the situation. Then the third point, I will encourage the patient to recognize his or her own strengths and abilities to promote awareness. So this point is basically saying we as nurses need to help the patient recognize that he or she has the strengths, the abilities to cope to this new condition or to this condition that has been affecting them. So this, when the person is going through a difficult situation, they lose the ability, they lose the ability to be self-aware, they lose that self-awareness. So they lose they lose that knowledge to say, I have the strengths, these strengths and these abilities so I can cope with this condition. So you as a nurse, it's your duty to help this patient recognize that he or she has the strengths to beat this condition, to cope to the new situation. And lastly, I will provide a chance to express concerns, fears, feelings, and expectations to reduce anxiety and open doors for ongoing communication. So here you find that as a nurse, you have to create an environment where the patient feels comfortable to talk, to express their fears, their concerns, their feelings and expectations so that they can be more vulnerable to you, open up and share how they feel rather than them being conservative. And that will help them to cope, not only cope but also open up doors to new conversations and communication. And another point that we can also add here is involvement of the family that will help the patient to cope. Also involving spiritual leaders such as the pastors, the priests, the bishops, that will help encourage the patient and will help them cope even better. So those are some of the interventions that we have put in place to treat our patient with CCF, that is having a problem in ineffective coping. So how are we going to evaluate our patient? The patient says he or she feels more confident about dealing with a situation, evidenced by patient verbalizing his strengths and abilities to cope. So here we are saying at the end of these interventions, after putting these interventions in place, the patient will say he or she feels more confident, they feel more comfortable, they feel that they can now handle this situation, they can now cope this situation by. And how are we going to know? How are we going to know? They will say their strengths and their abilities to cope. So basically, ineffective coping is about the psychological care. So all the interventions that we are giving is basically psychological care. So this is about ineffective coping. And our last problem for this condition that we found is risk for pressure sore formation. So pressure sores, these are sores that are formed in and around the pressure areas, such as the back, the hip, the sole, mostly the parts that lie on the bed or down when the person is sleeping. So this will be as a result of the edematous area. That's one of the reasons. Other reason is because this person is immobile or there's reduced movement. Therefore, that can predispose to um, pressure sore formation. So our nursing diagnosis: risk for pressure sore formation related to decreased circulation in edematous areas secondary to excessive fluid volume. So you find that this risk of pressure sore formation is coming as a result of decreased circulation going through or to the edematous areas, and this is as a result of excessive fluid volume. Now we go to the goal. How are we going to, or what do we expect to, what do we expect, what is the expected outcome after we give or we do our nursing intervention? So we want the patient to have an intact skin throughout hospitalization. So we want our patient to have an intact skin. So how are we going to achieve that? How are we going to maintain an intact skin by the patient? One, the nursing intervention. One, I will change the patient's position 2 hourly to prevent exiting pressure on the edematous area. So we know that this person is predisposed to pressure sore formation because of the edema. So I will make sure that the patient's position is being changed to hourly, so that there will be relief on these pressure areas that are edematous. That's one of the interventions that we can give, and this will prevent pressure sore formation. The second problem is I will change sewed linen to prevent moisture, thereby preventing skin breakdown. So here you find that the sewed linen will have moisture. This moisture, when the patient sleeps there, it will react and irritate the skin, therefore predisposing to the skin breaking, and this will now result in pressure sore formation. So by changing the sewed linen, you prevent the moisture, the formation of moisture on the linen or the wet linen which will irritate the patient. So by changing that linen, you are going to prevent the skin breakdown. The third point, I'll perform pressure area care daily to prevent pressure sore formation. So here as a nurse, especially in an immobile patient, you always have to perform pressure area care so that there will be no pressure sore formation. So that's the first thing. Then the second thing, you have to know that in an edematous patient, these are predisposed to pressure sore formation, pressure sores. So we should always perform pressure area care. So that's about the third point. And then the fourth point is saying, I'll assess the skin of the patient to determine the risk of pressure sore formation. So here, I will make sure that I assess the skin. How is the skin looking? Does it look red? Does it look like it's about to break? Does the skin look too soft? So I have to assess as a nurse and learn more so that I can know if the skin is at risk of pressure sore formation or of breakdown. So as a nurse, I have to check for the integrity of the skin. I have to assess the skin integrity. And the last point that we came up with, or that we have implemented on our patient, is I will straighten the bottom linen to prevent skin irritation. So the bottom linen is basically the linen where the patient lies on. So we have to make sure that this linen is straight, because if it is folded, it can cause irritation on the skin. And when it causes irritation, it simply means it can lead to skin breakdown, therefore having pressure sore formation. So these are some of the points that we have put in place to prevent or to maintain an intact skin throughout hospitalization. So now, how are we going to evaluate our patient? So the patient has an intact skin throughout hospitalization, evidenced by absence of pressure sore formation. The patient has an intact skin throughout hospitalization, evidenced by absence of pressure sores. So this is basically how we are going to evaluate our patient. The patient will not have any pressure sores. The patient will have an intact skin. So I've come to the end of our lesson, where I've looked at the nursing care plan for congestive cardiac failure, popularly known as heart failure. So we have looked at 5 problems, which is the first one being decreased cardiac output, activity intolerance, excessive fluid volume. The fourth one being ineffective coping, and lastly, risk for pressure sore formation. So if you have not checked out the previous videos where we spoke about the nursing care plan for hypertension and acute renal failure, just go into the link. There will be links in the comments. You can check them out. But thank you for attending our lesson. See you next time. Make sure that you like, comment, and share our video. So you can comment with questions and what you would like to see more on our YouTube channel. Thank you. See you next time. God bless.